Botox for migraine? So we have a question here from Kyla asking about Botox for migraines with aura. So just to clarify for anyone who's not sure, migraines are a type of headache. They're a very specific, more neurological type of headache. So as I may have explained in another video, if we say, look at these are all fingers, but only this is a thumb. So it's kind of like the same. All of these are different types of headache, but only this is the one which would actually be the migraine. So it's a very specific type of headache, and you can have with or without aura. With aura means that you'll get more of a warning system. So you'll start to have other symptoms, which usually will start before the migraines. This may be visual disturbances. This may be changes in, saying, zigzag lines. Lights may become brighter. You may hear things differently, smell things differently, have different sensations. So all of this would be an aura, a warning system prior to the migraine, the real head pain starting. Or you can have without aura, and without aura is just going to be without any of these symptoms, which goes straight into that migraine. In regards to Botox, I have seen this for a number of patients where for different types of conditions, whether it's for migraines, whether it's for facial pain, whether it's for spasmodic torticollis, for neck pain, or a different type of neck pain that would be, it can be helpful and it can be something which offers some level of relief. However, there's very few people I've ever seen where it offers any long-term changes. So it's not that Botox is a bad thing to do, and especially if someone has something very debilitating like trigeminal neuralgia, or they have cervical dystonia, also known as spasmodic torticollis. I understand why someone would choose to take this if they're offered this by the doctor, and I understand why the doctor would recommend it, because they do have a history where it can offer patients some level of relief, even if it is only going to be on a temporary basis. What we do see most commonly, though, for patients with things like migraines, at least in my own experience, is that patients will take it once, and they'll take it again, and they'll take it again, and they'll take it again, and they'll either keep taking it forever, and it will just become this constant kind of patch up for what's going on, or in some cases, they'll keep taking it, and it will just become less effective to a point where it becomes minimally or not effective at all. It's similar with a lot of other medications as well. So I'm not completely against Botox. However, there are some articles which I've read recently, and there's some long-term studies now showing that long-term use of Botox doesn't just stop in the tissues where it starts. So say, as an example, if someone has an injection into the side of the head or into the neck for a specific type of pain, like migraines with aura or like spasmodic torticollis, there's now research showing that it will stay in the bloodstream and it can then start to go to other parts of the body. And the other parts of the body which we're most concerned about is when it goes to the brain, because there is I think it's quite preliminary research from what I've read, but it may be more developed now, that if there is a long-term exposure to Botox, it can start to affect how the brain is functioning and affect things like mood and behavior. So it's more normal that somebody who